Welcome. Thank you so much for joining us for tonight's session. We're going to take a moment to let everyone come into tonight's webinar before we do our formal welcome. My name is Elise Murphy, and I'm the Associate Director of Graduate Recruitment and Visitor Experience here at the University of New England. I work in the Office of Graduate Admissions, and we're very excited to be joined with our College of Dental Medicine tonight. Tonight's session is really to explore our Doctor of Dental Medicine program, learn more about the mission of the College of Dental Medicine, your 4 years here, the student experience and that faculty relationship, as well as just learning more about our beautiful Portland campus and just lifestyle in Maine. So a little bit of housekeeping before we go into introducing the rest of our guests on tonight's session. We are recording, so we will post the recording on our Graduate Admissions YouTube channel after today. So if you want to watch that back or, sort of catch anything you missed, you're more than welcome to review that. And we have disabled the chat just so we can funnel all of our questions into the Q&A. So we will begin with a presentation. So while we're all presenting and sharing this information, feel free to add the questions in the Q&A. We may not stop and answer them. We'll get through the presentation and then open it up for questions at the very end. So with all that being said, I'd love to have first my colleague in the Office of Graduate Admissions, our dental medicine admissions counselor, introduce herself. So Cassandra, can you share a little bit about who you are?
Yeah, sure. Thank you, Elise. Hi, everyone. My name is Cassandra. I work in our Office of Graduate Admissions along with Elise. I am an admissions counselor. I work with our Doctor of Dental Medicine program. So I am your go-to person, as you're applying, if you have any questions about the process or anything like that.
Thank you, Cassandra. And I'm sure some of you have connected with Cassandra over email or Zoom. She's going to walk us through some important dates for the cycle and provide some overview of the admissions process. So if you have any questions about admissions, we'll also share her information that you guys can connect with her after today. So without further ado, I'd love for our College of Dental Medicine to introduce themselves. Dean Kimmis, would you like to start off introductions and then we'll throw it over to Dr. El Salhi and Dr. Erickson?
Hi, everyone. Great to have you with us tonight. Sorry I can't see your faces, but I'm really excited to share information about our wonderful program with you and share this time with our colleagues who will also provide some helpful information. I'm Nikki Kimmis. I serve as the Dean of the College of Dental Medicine. I've been at UNE for 10 years. Just love Maine. I moved here in 2016 and celebrated my 10-year anniversary just last month. So very excited, and I'm happy to pass the baton on to Dr. Erickson.
Hello, good evening, everyone. My name is Dr. Travis Erickson, and let's see, I'm the Associate Dean for Student Affairs and Alumni Relations here in the College of Dental Medicine. I've been a part of the UNE family for about 23 years, but I joined the College of Dental Medicine as the Student Affairs Officer, if you will, in 2014. So it's been wonderful to be a part of the journey of CDM as it's evolved from a new dental school into a little more mature dental school, if you will.
Hi, everyone. My name is Dr. Muhammad El Salhi. I am a dental public health dentist and the Associate Dean of Academic Affairs. I oversee the curriculum and also one of the course director for D1 and D2 courses.
Wonderful. Well, thank you all for those introductions. We'll be hearing from everyone throughout the presentation tonight, so I think it's good to get to know you initially before we dive in. So we're really going to spend the majority of the time talking about our College of Dental Medicine. But to set the stage and those who are just getting to know the University of New England for the first time, welcome. We're so excited that you're exploring our university. We are proud to say that we're the #1 provider for health professionals in the state of Maine. We see about 25% of our graduates staying in Maine, which is wonderful. And we're excited to see that. And really, our mission as a whole university is to educate health leaders who make a difference for their patients and communities. And as you can see, alongside dental medicine, we also have medical students. We have occupational therapy, physician assistant, pharmacy, nursing, dental hygiene. So all of these programs come together nicely on our Portland campus for the health sciences to learn with and learn from one another. Tonight, you'll hear about interprofessional education, and really, in its simplistic terms, is just that work, that group work, understanding each other's role on the healthcare team and understanding the perspectives of your different areas that you're excited about. You know, you're all sharing the same patients, so understanding the roles and how you can best support their care um, has shown to prove, improved patient outcomes. So we're very proud of that. And I think our College of Dental Medicine colleagues are going to walk through some examples of how you work with other programs here at UNE. So just quickly, we have two main campuses, one in Portland and one in Biddeford. You as a dental student would be based on our Portland campus, but we have the Biddeford campus just 30 minutes south. And as a UNE student, you'd have access to this campus, and I'll show you a photo in a second. It is really a um, beautiful campus. But we're in Southern Maine. We are very, accessible from Boston. It's about a 5-hour drive from New York, and there is a great airport in Portland that does have direct flights to many cities throughout the country, and it's just a really nice, easy airport to get through. We'll talk a little bit more about Portland, and hopefully you all have or will have an opportunity to come to campus. But before we get into that, here's a look at our Biddeford campus. As you can see, we're right on the coast. We're actually situated at the mouth of the Saco River that opens up to the ocean. So on this campus, we have a great library, gym, a pool, an ice rink, and other study spaces. So if you are living closer to the Biddeford campus, you have access to this. And here's a look at our Portland campus. So we're not directly on the coast, but you can still see that beautiful ocean view. We're about 10 minutes outside of downtown Portland, and this is where we have all of our graduate health profession programs come together. You'll also get to understand and learn more about our oral health center, but this is a really great campus community. It's lively, there's a lot of events, services, and resources, which Dr. Erickson will walk us through in a few short slides. So, just quickly, for those who haven't visited Portland, it's truly a great city to be in. It's got this ease about it, but there's a lot of things to do. It has great food, great restaurants, breweries, music, art galleries, a great museum, and all of the quintessential things you think about, Maine. But I think life in Maine goes beyond just the Portland, downtown area. There's ferries that you can take out to the islands and explore. You have Acadia National Park, which is just about 3-hour drive. There's hiking trails, skiing, snowboarding, and it really does give you this beautiful, well-rounded life. You will be busy, and we'll hear in a minute about your 4 years and your time within the College of Dental Medicine, but having a peaceful place that you can do it in and explore and be a part of this just wonderful Maine life may make it a bit easier. But we'll hear more from our College of Dental Medicine about that. Yeah. So Dean Kimmis, feel free to dive in and take it away.
For sure. Thank you so much, Elise. That's a wonderful introduction. I'm going to give you kind of a intro to the college, and then I will pass it on to Dr. El-Sali, who's really going to go into more details about the actual curriculum. But I'll talk about our mission, show you what the spaces are. We have a little video that we'll play since you're not here in person to see our spaces. So let me see that I can switch the slides. There we go. So our program, relatively new, as Dr. Erickson mentioned, our program started in 2013. So very excited. This May, we graduated our 10th class. So we've reached the double digits in graduating classes that we celebrated. And we really have a nice community feel. We have a small class size. There are 70 four-year DMD students in a class. We also have what's called an advanced standing track for foreign trained dentists, for those trained outside of the United States as dentists to do an expedited 29-month program. And those students integrate right into the class so that at graduation, there are 72 students in a class. We did a bit of an expansion a few years ago. There are access to care challenges throughout New England, and we are here to help with that. So we had the opportunity to increase our class size, but we're still a very nice small class. And that's really important. Dr. Erickson will talk at the end about student support. You can't get lost here. We know our students, our faculty know you well, you know one another, and those outside the college also know our students and are there to support you. We're the only DMD program in Northern New England, and we were placed here by the people of Maine. They supported the building of our dental school so that we could help, especially with the access to care challenges in our rural and underserved populations. Dr. El-Sali will talk more about the integrated and simulation didactic learning, our public health emphasis, and our curriculum, but those are things that we're very proud of. We designed our curriculum with that emphasis from the start. And as Elise mentioned, we have other health professions right here on our campus. The College of Osteopathic Medicine moved here 1 year ago from our Biddeford campus. And so now all our health professions are housed on the same campus, learning together, having lunch together, interacting with one another, going to the gym together, things like that, which creates a really nice opportunity for our students. We also have robust clinical rotations. We'll talk more about those later tonight, and a group practice clinical model. So our mission is really, as I mentioned, we're here for the people of Maine and Northern New England. So our mission is to improve the health of Northern New England, as well as rural and underserved areas, while shaping the future of dentistry through excellence in education, discovery, and service. And here you see a picture of our clinical space. Our simulation clinic and patient care clinics are housed in our oral health center, a new building that was built in 2013, opened to patient care a few years later by our students and our faculty. It's a very nice space. You can see, a lot of windows, a lot of bright light, and we're just in a great location, which is really great for our patients. It's accessible by public transportation as well, and we're right on the campus where everything is happening. So you don't have to travel away to a clinic every day. It's just right here. So from the very first week, the very first day, you will be in the Oral Health Center Simulation Clinic. And here is where you learn to do dentistry on dental simulators. And these are designed to be just like dental operatories, so that you have the overhead light, you have an electronic health record, and you have all of the same setup so that you can start practicing good ergonomics from the very first day. So you learn good habits to take care of your body. So sitting straight and all of those things are very important. And every student has their own assigned simulator bench that you use. It's shared by the first and second year students throughout the week, and a little bit by our third year students. And we have a dispensary. Basically, that's all the instruments, materials, and supplies that you need is right there with a professional staff who helps support you in that manner, giving you everything that you need. And we have a laboratory that's also connected to the simulation clinic. We also have some virtual reality haptic units that are located in the simulation clinic as well. There are 2 units that are there available to students to use, and they're also part of the first year curriculum for a few of the activities that students do. And this is a small picture of an operatory. We have 76 of these dental operatories in our patient care clinic. So we have a small clinic on our first floor and a larger clinic on our second floor, where general dentistry and all of the specialties are. We don't train residency or specialty programs, but we do have faculty and students completing those procedures and providing those services to the community. So you get that well-rounded experience as a student here. Being a newer school, we have new technology and equipment available to our students, and we're supported very well by our university to keep this current and replace things as needed. We have endodontic microscopes, 3D printer, digital impression technology. We just upgraded our scanners, our digital scanners as well. And our clinic is open to the community. So we are here 5 days per week, 48 weeks per year. We are open and serving the public. Our students don't have to search for their own patients. We get that question a lot, so I'll just answer that one here. We have patients that are calling to be screened and be seen in our clinic for comprehensive care. So we have a good, robust patient population. And I'm going to show this video to give you a tour through the clinic and show you some of those spaces. This is one of our now graduates and one of our faculty members, and they'll kind of show you the different spaces.
Clinic. This state-of-the-art facility is full of mannequins for our practice. This is where we really hone our...
Hello, I'm Dr. Albert Abina.
And I'm Lizzie.
Welcome to the Oral Health Center.
Welcome to our simulation clinic. This state-of-the-art facility is full of mannequins for our practice. This is where we really hone our clinical skills. We learn from our peers, and we get a lot of feedback from faculty. This is an awesome environment that you'll spend a lot of your first couple years here in. Off of the sim clinic is our wet lab, which is a hands-on workshop area where we learn laboratory procedures, such as creating stone models.
One of the advantages of UNE's Oral Health Center is that we have technology, such as these virtual reality Simodont units, that allow students to develop their hand skills and prepare for taking care of patients in the future. As they further develop their skills, we have this 72-station simulation clinic that allows students to interact with faculty at a high level and further develop their skills, competence, and confidence levels in order to take care of real patients in our patient care clinic upstairs.
One of the best parts of UNE, and one of the reasons I chose to come here, was our early clinical exposure. Starting your second year, you'll come up to the patient care clinic and start working on real patients in state-of-the-art stations, just like this one. The clinic has 76 stations and is equipped with everything we need to perform a full range of dental services, including specialty care. We have intraoral scanners and milling units that enable us to capture digital impressions to fabricate crowns and bridges. Our surgical microscopes allow students to have improved visibility while providing root canal treatment in our endodontic area. In the radiology area, we have our CBCT machine, which allows us to diagnose diseases of the hard tissues and evaluate anatomy for implant planning.
Our patient care clinic serves the main public, improving access to care for underserved populations. In each of our touchdown stations, students and faculty work closely together, collaborating on treatment plans for patients.
With the variety of skills I've learned while working with patients here, I feel well prepared to begin my professional career as a dentist.
Dental students also have access to the Interprofessional Simulation and Innovation Center. Here, students work with other health professions in team-based, hands-on exercises. Thanks for learning about the UNE Oral Health Center.
And we hope to see you in Portland, Maine soon.
Okay, thank you for that. And I'm going to pass it on to Dr. El-Sali now to talk more about our curriculum.
Yes, thank you, Dean Kemis. Let's talk more details about our curriculum. So the highlights of the D1 and D2 years the focus is foundation and integrated biomedical sciences, behavioral sciences, clinical sciences, and public health. Our students enter the simulation clinic in their first week. They get their instruments, they are ready to drill teeth and restore them. They also have early experiences in the OHC. Every Friday, they have peer-to-peer activities as D1s. They learn how to do examination on each other, how to do cleaning on each other, and some other activities. When they enter the D2 year, they start having dedicated half days in the clinic where they are paired with their D3 and D4 partners to provide actual care on patients. They also have lots of outreach activities during the D1 and D2 year. For example, D1s go to schools and do oral health education in the primary and elementary schools, while D2 have outreach activities where they interact with special needs populations. When they enter the D3 and the D4 years, the emphasis is clinical care and experiences. D3 students have 3 dedicated days for patient care and 1 day of treatment planning. D4 students have 4 days in the clinic and 1 day of treatment planning per week. Throughout the D3 and the D4 years, the students have rotations, including urgent care rotation, screening rotation, or new patient encounters. They also have rotations at the Center for Autism and Developmental Disorders, in addition to pediatric rotation. So there is a group of rotation that they need to complete, especially in their 3rd year. In addition to that, they do have some didactic content. For example, the D3 students have didactic content on Fridays, where they do some advanced topics like scanning, some denture repairs, and they also have practice management module where they learn how to run an office, how to manage bills and things that as an office owners and as dentists when they graduate. They also have integration seminars and electives. In general, we offer different specialty electives throughout the year, and the students choose 2 electives of their interest during their 3rd year. In the 4th year, the students have community-based clinical externship rotation, which is a semester-long rotation, and we'll talk details later on about it. In the clinic, we run our clinic in a group practice model. So students are assigned to one of 4 group practices, which contains D2, D3, and D4 students. This allows a close focus on their training, as well as vertical integration and learning from each other. Within the group practice, the focus is patient-centered comprehensive care. So rather than specific procedures. So that when they have the patient, they treat the patient as a whole, rather than doing a specific restoration here and there. Group practice leaders, which are faculty, are the ones overseeing the students and working very closely with them. And every group practice has a patient care coordinator. Both would help ensure that all the students have enough experiences they need to be competent in all competencies that they need before graduation. Key highlights of CDM at UNE, UNE CDM, is the D4 extension rotation, interprofessional education, and the supportive environment. And now I'll share some more details. And these are why we go to UNE, why UNE is special. The key highlight is D4 community-based externships. These are semester-long rotation, and the students go in these rotations at least once in their 4th year, where they spend the whole semester or 10 to 12 weeks in federally qualified healthcare center, private practices, or nonprofit clinics, where they provide an actual care for patients in an actual clinical setting that they will work in after graduation. Majority of our sites are in Maine, Vermont, and New Hampshire. We do have a few sites in Boston and Rhode Island. Again, students are assigned at least one of these rotations, which are semester long. During this rotation, they work under supervision of preceptors, where they develop a good professional relationship with them. Site placements are carefully selected by our community-based education manager. Another key highlight that is very important at the university level and the college is interprofessional education. Our 3rd year students teach osteopathic medicine and physician assistant students how to perform oral head and neck exam, as well as fluoride application. Also, our D4 students participate in medical emergency training with the dental hygiene students in our interprofessional simulation and innovation center. And these are just examples of interprofessional education exposures within our curriculum. At the university level, the university has Center to Advance Interprofessional Education and Practice, which allow additional opportunities for interprofessional collaboration outside the curriculum. CABE is the hub for interprofessional education and collaborative practice at the university. Their mission is to prepare students to work together across discipline to achieve the most successful outcomes as member of a clinical team in their communities. Opportunities that CABE provide include IPE honor distinction, team immersions, lots of interprofessional simulation training and cases. They also provide mini grant and cross-disciplinary surface learnings. And now, Dr. Erickson will talk about student success.
Thank you, Dr. El-Salhi. So, I've been a part of the UNE Portland campus for the health sciences community for a very long time. I've been very proud of the robust set of services that have evolved here on the Portland campus. Given that is a graduate and professional kind of environment, the services are tailored for students who are embarking into a health profession. There are also the programming student life experience is also designed for graduate and professional students. So there's opportunity in a variety of different ways to be engaged, to engage in wellness and other ways of engaging in Portland, including all the restaurants that are here, which is certainly, if you talk to any of us on this campus, we'll always mention that. So the services that are available to students, again, are the Student Academic Success Center, which provides one-on-one support, as well as peer-based tutors, writing support, and such. The Student Access Center, again, they provide one-on-one services with students who have documented medical disabilities who are seeking accommodations. Additionally, we have an Office of Career Services that serves all the health profession programs here on the Portland campus. Again, we work collaboratively with them to host a dental career fair and networking fair annually, and they also provide one-on-one student services to help students prepare for interviews, prepare CVs, other types of postgraduate applications and such. So also counseling services is free and confidential, available to our students. There's also after hours support 24/7 where students can reach out and reach a counselor depending on what, if a challenge pops up during the night, for instance. Additionally, students can utilize our Student Health Center, whether that be here on the Portland campus for the health sciences or on the Biddeford campus, depending on which location is closer. And we also have a great Office of Graduate and Professional Student Affairs, again, that focuses on student life and student advocacy and support for students above and beyond what the college can offer. The other, again, the student life experience here, again, is tailored for our students. There is opportunity for outdoor adventure trips. There's also almost continuing education through the robust set of student organizations that we have here on the Portland campus. So. Additionally, we work hard to support our students. The environment here, I think what would stand out is that we are a collaborative learning environment, meaning we have a pass-fail grading system. We encourage our students to work together, learn together. Of course, every student has to demonstrate their competency independently, but we also work really hard not to have a competitive learning environment here. As part of our strategy for student success, we do staff our oral health center simulation clinic after hours and on the weekends with D3 students who we hire as teaching assistants, and they can provide one-on-one hand skill support and guidance, and just from the sheer fact that they've been through the same courses that you'll be going through. So they can bring that pragmatic perspective to your experience. Additionally, as I mentioned earlier, the Student Academic Success Center hires dental students who are upper class dental students who've been through the same courses. They actually get certified to be peer tutors, receive training, and they offer one-on-one and group sessions on our Portland campus here. Additionally, first and second year students, everyone is assigned an academic advisor, and that provides the opportunity for a dentist who's and or a faculty member who can be a mentor for the student as they navigate the first and second year. And as Dr. Salhi mentioned, with our group practice model, students are assigned into a group practice into their second year, but the third and fourth year is when they really receive mentorship from a group practice leader who helps guide them through the predominant patient care part of the curriculum. Additionally, again, as I mentioned, we want our students to be successful. We work really hard to support them as they navigate the curriculum. As you all are, likely high-performing students who've done well in undergrad, the dental school environment can be challenging. The strategies that you used for studying previously you may have to tweak your approach. And so as part of that, we do have an early intervention strategy to try to prevent course failures. It's a collaborative effort between the student, the academic affairs team, the student affairs team, and the academic advisor. And we work together to develop basically a personalized personal improvement plan in order to help connect students with the appropriate services. All right. So I believe that was my last slide.
Great. I just want to, I'll just transition over to some more admissions-based questions and information. But as most of you all know, now the ADIA Access portal is officially open and has been since June for the entering class of 2027. So just a couple deadlines and things to keep track of. The verified deadline for our program is November 1st. And so this is a verified deadline. So that means you have to submit your application to ADIA ADSAS and they have to go through the verification process before our office receives it. So this can sometimes take a couple days to a few weeks. So it's important to plan that out and make sure that you submit in time to get your application in before or on that November 1st. And if you have not taken the DAT yet, you do have to take it for the first time on or before October 1st. If you want to retake it, you can beyond that, but that first one does have to be done by that deadline. And then our prerequisite coursework is listed here. I did just want to make a note about the anatomy requirement. It is really the anatomy portion that is the required piece, although physiology is recommended. So this can be fulfilled in a couple ways by either taking anatomy with lab, or if your university did anatomy and physiology, you would need to take the full sequence of anatomy and physiology 1 and 2, both including the labs. If you do have any questions about whether your coursework fulfills a requirement, you can definitely reach out by email. We also do have a form to fill out with, a syllabus or anything if you're not sure if what you took would fulfill the requirement or not. So a complete application has a few factors, but you will need to have your 2 letters of recommendation, one being from a science instructor, your official DAT scores, as well as your minimum 30 hours of dental shadowing or experience. So after your application is verified by ADIA ADSAS, and we will receive it in our office, it will undergo a preliminary review to check for some of those factors that I mentioned earlier, such as you have your shadowing hours, you have your letters, everything is accounted for. From then, qualified applicants will be, with a complete verified application, will be sent a supplemental application processing fee. And upon receiving payment, you will then go on to an additional review by the admissions committee. And then from then on, qualified applicants will then be invited to interview, which is a required part of the process. They are by invitation only. Typically in the past, they start around August and go through the winter, sometimes into the spring, depending on the cycle, and they are virtual. The first time, according to ADIA ADSAS traffic guidelines, the first time you can be notified of a decision will be on December 15th this year. So that's the first day. And then from then on, you can really hear anytime on a rolling basis until the class is full.
Well, thank you, Cassandra. We're going to end the presentation in just a moment, but I do want to share a save the date for our fall open houses. We'll have one towards the end of September on Saturday, September 26th, and then another one on Saturday, November 7th. And we'd be happy to welcome you to our Portland campus for the health sciences, where you'd be able to see in person our oral health center, connect with our faculty, current students, but also get a sense of our campus community alongside our other health profession programs. And fall in Portland is, I think, just as nice as summer in Portland. So it's definitely a great time to come visit. And we will be making our registration live the first week in August. So you can kind of keep an eye out for an invite coming in the next couple of weeks. And, after today's session, we really are excited to stay in touch with you. We invite you to follow our College of Dental Medicine's Instagram. Here's Cassandra's direct information, but you're also always welcome to just email our gradadmissions@une.edu email. It will then go right over to Cassandra. She's happy to, as mentioned, review your transcripts, connect on the timeline, and will be a point person throughout your application process. So we're going to come to the end. I'm going to stop sharing, and then we're going to open. So we have about 24 minutes for questions, which is a great amount of time. I'm going to take a quick moment to look through our Q&A because we do have some questions submitted. So we have a question about how many patients do each student see before graduation? Do you know that number, or is it unique to each student?
Yeah, it really does vary because it really depends on the patient's needs. Our students have to complete case types. So, one patient may have multiple case types and others may only count as one. So, when we're also really focusing on providing comprehensive care, which means if a patient has a extensive treatment plan, that student isn't going to have multiple patients that have those extensive plans because you need to focus on providing care for that patient. So, we have in the group practice model, what Dr. El-Sali explained, that group practice leader faculty is really overseeing what that patient family is, what we refer to, your group of patients that are assigned to you to see, so they can monitor the number of patients that you need to receive all of the things that you have to do to graduate. The other thing to consider is when you go out on your externship rotation, you're immersed right into a practice, and you will also be caring for patients there. Those are not our patients of record, so we monitor your patient encounters, but we don't monitor your unique patients. So, it's going to vary depending on the student's needs for sure. And as I mentioned, we have we actually have a wait list of people waiting to get in to our clinic to be seen.
Thank you, Dean Kimmis. There was a similar question about how does UNE ensure that students are able to complete all required clinical competencies on time? And what systems are in place to support students if they have difficulty obtaining that necessary patient experiences? But it sounds like there's a very healthy flow of patients coming into the oral health center. So anything else to add there?
Yeah, I would add, and Dr. El-Sali may want to chime in as well. We have what's called a student progress review process, which is something that is a student doing a self-reflection on a variety of things of where you are in your trajectory from a entering third year student all the way up to graduation. And that's looking at your patient experiences, your comfort level, that family of patients that you have, management of those patients, the individual experiences you've done done, as well as attempting the assessments, the individual competency assessments that you need to challenge. And you're meeting with your group practice leader on a regular basis for those. They're formalized each semester, at least once a semester, but you also in those treatment planning days have access to that group practice leader and patient care coordinator together to talk about where you are. So if you feel that you need more patients for something, we have a screening process by which patients are brought into the clinic and assigned then to the students based on need. Dr. El-Sali, do you want to add to that? I'm sure I skipped something.
No, thank you, Dean Chemist, for elaborating. I wanted to mention the student progress review. In addition to that, students are working closely with their group practice leaders. We do have committees that oversee student progression too, outside the group practice. So we call it the CCC, or the Clinical Competence Committee. They evaluate student progress throughout the years, and if there is any issue, they would highlight and intervene early to prevent any delays in their progression.
Wonderful. Thank you both for your responses. Dr. Erickson, maybe you can share your thoughts on this, and then our other panelists can maybe share theirs. So we talked a lot about the community and who's on campus and the opportunities, but from your experience, what's the general culture like with the cohort and just the CDM community, in your own words, in your own experience?
Yeah, of course. As you might imagine, dental school is a very immersive experience. You spend a lot of time together, both with your peers and your faculty. It's pretty much like a full-time job, if you will. So you're going to make some very strong interpersonal connections, certainly with your peers and faculty. But what's unique, I think, about the Portland campus for the health sciences is where we have the College of Medicine here, as well as some other health sciences programs. So there's the opportunity to get to know other members of the healthcare community here. And so with that, I would anticipate that many of our students would describe it as, you develop lifelong friends after, and also a professional network from being a part of this particular culture. The other thing, as I kind of noted, and we actively try to support, is the collaborative framework toward learning. So we want students to, whether it be to capitalize on the opportunity to do group work, group study. And you'll also notice when you come to campus, there are study locations throughout the campus. And even if you're here after hours, you will notice students tucked away in different spots, studying, and yeah, it just has a very professional vibe. So.
Dean Chemist, Dr. El-Sali, anything to share about just the general community and what you see your students sort of experiencing? I always see them with big smiles on campus and always having fun and laughing. So Dean Chemist or Dr. El-Sali, anything that you notice about your students?
Well, because they spend most of the time together all the week, I think they see each other more than they see their families and other friends, which create a new connection and new friendships. And I think it's a very collaborative environment where they help each other, support each other throughout.
Yes, and I really think this sense of community. I came as a consultant. I was kind of scrolling through the Q&A, and I think somebody kind of asked this question, a similar question. But I visited here in 2015 as a consultant, and I was at another dental school. And between the mission of the college being very apparent that everyone was working towards that mission, and just the collaborative nature of how the team was around the table working together, is what made me leave here saying, someday I think I want to go back there. I wonder how I can do that. And I felt that way every day that I've been here. I look forward to coming to work. And I'm not saying that just because I'm the dean of the college, but honestly, I think if I didn't show up, I would have someone texting me within 15 minutes asking if I'm okay, because everybody really is looking out for one another here. And that creates, that's across faculty, staff, students, and across the university. And that creates a safe learning environment and a healthy place to be for 4 years.
Yeah, I agree with that completely, Dean Kimmis. So you did well mention that it is a pass-fail curriculum, which definitely reduces some of that competitive nature, really helps support that collaborative and group approach and mentorship. Just a quick question, students are obviously building experiences and working towards that CV that they're going to, apply and go into practice. How do they distinguish themselves, I guess, within a pass-fail curriculum? Is there an opportunity for that? Thoughts on that question?
Dr. Erickson
Yes.
and Dr. El-Sali, I'm going to let them answer this one.
Mhm.
Yeah, so I'll start. Within our courses are all pass and fail. So students need to score specific numbers to pass the course, finish specific requirement to successfully pass the course. But all courses, or at least most courses, has something called letters of commendations. So these letters are to distinguish students who perform very well in the courses. And every course has their own criteria of distinction in a way where they receive the letters. The goal is to identify and highlight the top 10 to 15% of the class. And we use these to identify the stars in the class, especially when we write their letters of recommendations for residencies and other things. And within the courses and everything, the college offers lots of opportunities for extracurricular activities where a student can participate in outreach activities, in some community events, which actually improve their CV and make them more distinct outside studying and exams and the curriculum itself.
Yeah, and I would also just note that we're not the only dental school that has shifted to a pass-fail curriculum. The IDEA pass process, the institutional evaluation that's a part of that, the language that they use has changed. There are fields for us to qualitatively be able to describe how a student performed. Also, the dean's letter portion of that process allows us to and the approach we take is a very tailored approach to describe a student's strengths, what they bring. And sometimes we describe the areas that they're still growing. I think our students have done well as they've, looked toward postgraduate education or advanced training. Yeah.
Thank you both.
I want to add, Elise, that in addition to that, in the fourth year, we do have an award ceremony where we award students who do something special in one way or another. So some students will get the award for academic performance, some students will get the award for clinical performance, some are for implants, some are for endo. So we do identify students who shine within the curriculum, either didactically or within the clinical fields. So we do have this award ceremony where we recognize the star within different fields, including public health, community service, and different awards.
And I
Thank
would
you, Dr.
highlight that. Oh, sorry, I'm going to chime. I said I was going to let them answer, but now I want to chime in. I think there's a lot of other things that sometimes are hard to measure with an exam. Professionalism, ethics, all of those things is really how you are in that moment. And the faculty and the group practice leaders, as I said, we're small. They know you very well. So when Dr. Erickson is writing the dean's letter, if you're applying for a specialty program, those faculty provide very good feedback also that helps to really tell your story and help with that application process as well. We also look for students who are out and engaged in doing outreach and public health. That's our mission. So also when we are awarding students, it's not about the scores on the exam. It's about those other things as well, which we value and feel are very important.
Well, Dean Kimmis, this is actually a nice segue because we have a lot of questions about applying to the college. And you've just shared some of the characteristics that you see in your students. What are you hoping to see in your prospective students that can help support your mission?
Yeah, no, I think you definitely, and I'm going to have Dr. El and
Oh,
Dr.
yeah.
Erickson chime in on this too, because they are the ones evaluating applicants. But really, I always say when you're applying, be yourself, tell your story. Don't try to be somebody else, be genuine. And look at our mission. Every dental school has something different, and, find the dental school that aligns with what you're looking for. We want the students that are aligned with what it is that our mission, why we're here. So, as I mentioned, we're very public health focused, and we want to get out into the community as well in a collaborative, non-competitive learning environment. And the other thing is that we're not all going to walk into dental school. I can talk about myself in dental school. I wasn't perfect at everything. I had to, learn some things by doing it over and over and over again. Other things come very naturally. And I think, that can be one of the hardest challenges in transitioning into dental school. And so I think, being okay with that. I'll kick it to Dr. Erickson or Dr. El Sali to add on that when it comes to the admissions process.
Something unique at our college that I love really is how holistically we evaluate applicants. So it's not the GPA score is the reason for entering the program or not. There is more than that. When we evaluate applicants, we see them as a whole. And this is why if you see our current students, they come from different perspectives, different backgrounds. Some are career changes, some are working in rural areas. So when we look at them, we evaluate them holistically. And I think that is unique. So students, it's not the GPA per se is the reason to get accepted. And I think that's something unique. As long as the person has what they need to succeed, and if their goals align with our mission, and they are interested in serving communities and helping people, this put them higher in the ranking. And we are interested in those applicants.
Yeah, and the other thing I will, and again, it's still a competitive process to get into dental school. There are more applicants than there are seats. So it may take some, prospective students, a couple of cycles in order to, get into dental school. I think the key I would say is continue to work at it, continue to strengthen your application, demonstrate your interests. Again, if you're interested in a program like ours, we want to see that you're engaging in supporting your community, engaged in community service, and that you have a, strong understanding of what the profession is. So.
Well, thank you all for those responses. And we do have other questions about like prerequisites and other requirements in the admissions process, but I would really encourage you to connect with Cassandra, email our gradadmissions@une.edu, and she can connect personally over email. And I think we have a couple more minutes, spend a few more minutes talking with our College of Dental Medicine. Um, I wanted to ask, because we have a question about what are some examples, and I think, hearing that students start to get integrated into the oral health center during their D2 year, that's exciting, but they wonder, what are they actually doing? Are they treating patients? Are they diving in, or are they slowing that and getting eased in, but taking on more responsibilities? So what does that like next step look like for D2 students?
I'll start. I think I'll take a stab on that. So our students start entering the clinic with some dedicated time, basically when they start the second year, the summer of the second year, usually either Friday morning or afternoon. And then when they enter, they have a packet they need to complete called Welcome to the Clinic packets. They get an orientation, and there are activities they need to complete to introduce them to the clinic. And as they progress in the second year, these activities goes higher. And those will start with collecting medical history, filling charts, taking radiographs, things that they learn in the previous courses, like what they learn in the D1 class. Some of them may be restoring a tooth, and as they progress, they will do different things. They are under full supervision with their, of course, group practice leaders and faculty, as well as their senior students. They are always paired with a D3 and a D4. So when they see a good case that align with what they are ready to do, they will let them do it. When they move to this fall semester, they actually have 2 dedicated half days where they go to the clinic and they do have another packet with advanced things that called will come back to the clinic. And they fill that, they do lots of activities. Here they would give more anesthesia, they will cleaning the teeth. When they enter the spring of their second year, literally every afternoon is a clinic afternoon, Monday to Thursday. So they are here. That's the start of the full integration in the clinic. They would be part of screening appointments. They start establishing their family of patients, so that when they enter the third year, they are ready with all what they need to go to progress more and do more advanced procedures as they go. So they go in slowly, but whenever they are ready to do things, they are allowed to do them and they progress as needed.
And they are integrated into the group practice. We assign them at the end of the first year. Everyone wants to know the secret of how we assign it, which we're not going to give that away on the webinar. But essentially, that's your group practice home for the remainder of your time. So your second year, third year, fourth year, that's the home you're assigned into, the group practice home that you're assigned into. And also you're with that same group of colleagues and your faculty group practice leader, who, as Dr. El-Sali said, as you're doing those activities to integrate you they see your progression from one semester to the next. So we have 3 semesters. Summer, I saw the question about our semester schedule. Summer is May to August, and then September to December is our fall semester, and then spring semester is January to May. So you're building up, and it's really, you're integrated into that patient appointment. So you're part of the appointment. You may be able to do a portion of that. You might be able to make the impression or place the rubber dam or something like that. And then you do reflection assignments where you talk about your contribution to that appointment, what you might have done differently if you were the provider, and you provide some evidence. You look for some evidence related to that appointment. So you're really kind of eased into where the clinical third and fourth years are much more time in the clinic. And in the second year, you also become part of the treatment planning activities. So you get to see how that works as well.
Well, that's great to know. And with just a couple of minutes left, we have way more questions than we'll get through in the next 4 minutes. So hopefully the presentation and our discussion right now has provided you with the information that you were looking for. And if you have any questions after today, definitely connect. But I do have one more question that's, I think, taking a bit out from just talking about the College of Dental Medicine and just talking about your life in Maine. Would each of you want to share what do you enjoy doing in Maine, or what's your favorite restaurant, or anything that you like outside of just UNE and the College of Dental Medicine? Dean Kimmis?
First. Oh, geez.
Dr. Erickson, we're going to throw it to you
he's
first.
lived here longer than me.
Oh, okay. Yes. So, I think for me, what stands out is being in the greater Portland area. You're in kind of Maine, well, being in the city of Portland, you're in Maine's version of the largest city. But the good news is some of those, traffic is relatively not that bad unless there's construction going on. And with it is also access to many of the cultural theater. Again, Boston is very close. So there's opportunity to go out, eat, have fun, enjoy. And the other good thing is you're within like 30 minutes, you can be in a very rural area. You could be heading, be on a lake in short order, or on the ocean, or in the mountains. So the White Mountains, for instance, are but an hour away, and so a lot of if you enjoy hiking or just being outside or shopping, there's lots of opportunities. So
we like shopping.
Mm.
Just kidding. Dr. El-Salhi, what do you think? What's your favorite thing to do in Portland, or what do you love about Maine?
Well, Maine has this something strange that once you are in, you actually fall in love, and it's hard to explain why. It's just something you feel, you get attached to it. The unique piece, I think, it's called Vacation Land for a reason. And if you like summer and fall, we have the most beautiful summer and fall. If you like snow and skiing, we are the place to snow and ski. So you are actually vacationing the whole year in a way, just taking advantage of the weather and the activities. If you love hiking, it's all winter sports, all ocean sports. We have the ocean, of course, swimming, kayaking, lots of lakes, lots of beautiful places to look at. So you will never finish activities here. There's lots of things to do.
And I would say I love to hunt for sea glass, but I would say when I first moved here and I heard the story of when you cross the bridge from New Hampshire to Maine, the sign says like welcome home or Maine the way life should be. And I kind of chuckled when people said you take this just deep breath and you're like, ah, it feels different, but it truly does. And like Dr. El Sali said, it's just something kind of weird. It's really hard to describe it. I came from a very rural background. I grew up in South Dakota in a very, very rural place, but I feel very safe. I feel people know me, people look out for me, people stop so you can turn left in front of them even when no one's behind them. It's just a very welcoming and just nice place to live.
Well, I love those responses, and it's just nice to hear about your experience just living in Portland and in the state. And we've reached the end of our hour, so I just would love to thank our College of Dental Medicine for joining us and sharing a wealth of information about your community, your program. And thank you, Cassandra, for walking us through some of the admissions information and timeline. Uh, as our panelists said, Maine is great to visit. So you have to come for one of our fall open houses this year, and we'll share those information soon. But thank you all, and we hope you enjoy the rest of your evening. And we're excited that you're here exploring and getting to know our College of Dental Medicine. So everyone, enjoy the rest of your evening, and I'll end the webinar now. We'll connect
Thank
soon.
you. Thanks
Bye.
everyone for being here.
Bye.